we're going to be assessing your chest and your heart and your stomach today. Does that sound okay? You feeling okay today?
Yes, ma'am.
Okay. The chest is even. There's normal male hair distribution. Skin tone is good. I don't see any bulges or masses or lesions. I see a small macule near the right sternal border in the form of what looks like just a small macule, approximately 1 millimeter, but 0.5 probably millimeters in diameter. Are you having any pain here or anything like that?
No.
No? Okay. Can you raise and put your hands over your head? Put your hands over your head for me. Alright. Lean forward. Alright, and now sit back up. Okay. Put your arms down. Thank you. The clavicles are even. The intercostal spaces are even. Everything appears symmetric. I see visible respirations with symmetric chest wall movement. I'm going to do some tapping around on you, okay?
Sure.
Alright, if you would just turn and face this way just a little bit for me. Very good. Okay. If you will I am palpating for thoracic expansion, putting the thumbs near the vertebral column with a small pinch of skin between my thumbs. If you will just take a deep breath for me. Okay, and relax. Okay, there's even thoracic expansion. The antero-posterior diameter is half that of the transverse, which is normal. Alright, I'm going, like I said, to do some tapping. First of all, what I want you to do is I'm going to palpate for tactile fremitus. I just want you to repeat the words 99 a few times for me, just out loud in your normal, regular voice, okay? Go ahead.
99, 99, 99, 99.
Thank you. It is stronger at the apices than it is at the bases, which is normal. We will not be testing for bronchophony, egophony, or whispered pectoriloquy today. Okay, now I'm going to percuss the posterior portions of the lung. Okay, you can just breathe normal. It's going to do some tapping, okay? Okay, there is resonance heard in all areas, which is normal. And now I'm going to do some measuring on your back and some tapping. I'm going to ask you to fold your arms across your chest and lean forward just a little bit. Okay, about right there. That's good. Okay, if you would take a deep breath and hold it, I'm going to start at about the T7, T8 area. Okay, take a deep breath and hold it. I'm going to percuss downward from resonance to dullness. Okay, about right there. I'm going to make a little mark on you. Okay, now take a deep, breathe normal for me. Alright, now what I want you to do is I want you to take a deep breath, push it all out. When you push it all out, then stop. Okay, once you've pushed it all out, then stop. Okay, go ahead and do that for me. Push it all out, now stop. Okay, hold it right there, stop for me. Okay, right there. Alright, you can breathe normal. Alright, and that is approximately 4 centimeters, and 3 to 5 is normal. So that's good. Alright, and now I'm going to auscultate, which means I'm just going to listen to your lungs, okay? Okay, you can uncross your arms and just sit normal. want you to put your hands on top of your head for me while I listen on the front side, okay? You'll turn and face me. There you go. You always listen above the clavicle because the apices are above the clavicles. Okay, just drop your shoulders just a little bit. There you go, just like that. Deep breath. Okay, you can just rest your arms on one side. Breath sounds are clear, vesicular. I don't hear any wheezing, rails, or rhonchi. Inspiration is twice as long as expiration, excuse me. So everything sounds good? No coughs or anything like that lately?
No.
Okay. All right. Now we're going to be checking out your heart. Okay. Everybody worries about their ticker, right? Okay. Once again, we're looking at the chest. I see normal pulsations. And I'm going to be checking listening to your heart, feeling some places on your chest, and then checking your different pulse areas. Okay? All right. If you would lie down with your head facing that direction for me. Okay. I'm going to start by palpating at the right sternal border, second intercostal space, which is the aortic space, and the pulsation is felt there. Left sternal border, second intercostal space, which is the pulmonic area. Third, which is Erb's point, and then fourth, which is the tricuspid area. And then the fifth intercostal space, mid-clavicular line, which is the point of maximum intensity, the apex, and the mitral area. Okay. Those all feel good. Alright. I'm just going to feel your pulses. The temporal pulse. Okay. The carotid pulse, you want to check one at a time. Those are good and strong. Okay. The brachial pulses. The radial pulses. Okay, we're going to defer the femoral pulses, the popliteal pulses. Okay, spread your legs just a bit for me. Posterior tibialis pulses and dorsalis pedis pulses. Okay, I am going to auscultate the femoral pulses, temporal pulses, and carotid pulses, listening for bruits. And there are no bruits noted. Now I'm going to listen to your heart, okay? You listen at the right sternal border, second intercostal space. S2 will be louder because this is the aortic area. Left sternal border, second intercostal space is S2 will also be louder because it's the pulmonic area. Third intercostal space, left sternal border is Erb's point. Heart sounds are equal. S1 is the same as S2. Left sternal border, fourth intercostal space is the tricuspid area. S1 will be louder than S2. And then the mitral area, S1 will be louder than S2. Okay. All right. Now I'm going to be, I'm going to look at your stomach, okay? All right. I see no bulges, hernias, or masses. There's normal male pattern hair distribution. I don't see any peristalsis. Cullen's sign is negative. There's mild pulsations, which are normal. Like I said, no bulges, no hernias, nothing noticeable. Maybe a small macule here on the left lower quadrant. Okay. Now I'm going to listen to your stomach. Okay. Are you hungry? You listen in all 4 quadrants. And they sound normal at a rate of 5 to 35. Okay. You want to listen over the spleen, the abdominal aorta, and the liver. And there are no bruise or friction rubs hurt in those areas. Okay. All right. Now we're going to do some more of that wonderful tapping. Okay. You're going to percuss the abdomen in all 4 quadrants. Tympany is normal. Okay. The umbilical ring is continuous. There's no bulging or herniation noted. Umbilicus is midline and symmetrical. The umbilicus is introverted. Okay. You want to percuss for the location of the liver. You want to start at the umbilicus, and you want to percuss upward about the midclavicular line till you go from resonance to dullness. Okay, we're going to make a mark right there. Alright, and then we're going to start at about the 4th or 5th intercostal space and come down percussing from resonance to dullness. We went from tympany to dullness here, resonance to dullness here. Okay. Now we're going to measure that. And that is approximately 6 centimeters, and 6 to 10 is normal. Right. We're also going to percuss for the spleen. You're going to listen for dullness along in the costal region, and then tympany outside the costal region. And this will let you know that the spleen is not going to be palpable. Okay, all right. Now I'm going to do some pushing and poking. Okay. Okay. Any pain in any of those areas? Okay. If you'll just relax, and when I tell you just relax. All right. I'm palpating for the liver. Take a deep breath for me. All right. The lower portion is felt. Murphy's sign is negative. The edge is normal with no calcifications or nodularities noted. Because percussion was negative for splenomegaly, the spleen will not be palpable. And then you're going to palpate for the right and left kidney, which should be freely palpable in the right and left retroperitoneal areas. And they are. Okay, well, thank you so much. Okay, there we go.
14 minutes.
Thank you, son. You can go to bed now. Here's your